Hello, good evening. Good evening, viewing audience. Welcome to another live broadcast of the JAKQ Brothers. Peace and greetings to all. And I am your co-host this evening, Aquila Bia, your sister. And I would love to welcome and introduce all of my big brothers that make up the JAKQ Brothers. The A in JAKQ Brothers is no other than Brother Ahmed Bia. Brother Ahmed, if you would please give Brother Ahmed a JAKQ Brothers round of applause.
Thank you. Good
Brother,
evening.
I have a question for you before you get started. Did you want to greet the audience first?
Um, yes. Greetings to all. Thank you all for taking time out of your busy schedules. My name is Brother Ahmed. We're dealing with a very serious topic tonight. Dealing with COVID, a battle that we're all fighting on all fronts, and it's not getting any better. Seems to be getting worse. It's a very serious situation that we all need to look at and prepare our homes and our families in this battle. Thank you. What question did you have? Because on this show tonight, you might want to refer to me as Dr. Ahmed.
Is that right? Was that
Well,
honorary degree or something out of the Cracker Jack box? That's wonderful. We will give you an honorary doctoral title.
yes, ma'am. Thank you very much.
Yeah, so Brother Ahmed, I do have a question for you.
Yes.
Since you've introduced yourself to your viewing community. So you discussed in previous shows that you are continually developing yourself during this pandemic or pestilence from heaven is what we call it. And you've talked about some of your accomplishments and things that have how you've progressed, how you've moved forward and grown with the gifts and talents that you've had. During these times, tell me one thing that all of this, the pandemic, all of these things that happen and being shut in for over a year and a half, what has this done for you? Not to you, but for you.
It opened up awareness. There's been a I've become aware of the medical, the health conditions of myself and my family. I've become aware. It's united my family as well. A lot of my family, we were all just kind of living our own lives, but with this pandemic, we've kind of all shut in. We have Zoom calls. We're getting more involved in each other's lives. Uh, Nieces, nephews, aunts, uncles. We've lost a couple of family members, but beyond it all, we've become a tighter unit as a family.
Yes, sir. Well, that's wonderful. Yes, sir. Well, fantastic. All right. Well, we're going to move on to the Q in the JAKQ Brothers. No other than Brother Kawi Muhammad. Let's give Brother Kawi Muhammad JAKQ Brothers round of applause.
And thank you for tuning in to another episode of the JAKQ Brothers Presents Let Us Make Man. Like Brother Ahmed said, we have COVID-19 up front and personal with us. And we got two individuals on this show tonight that's going to give us some information as to how to protect ourselves or to at least make us stronger to deal with such a virus. So I have my notepad ready with my pen ready to take my notes. I hope you have your pen and pad to take your notes. So
Yes,
thank you again for tuning in.
fantastic. Well, Brother Kawi, I have one question for you, sir.
All right, I wasn't ready for it, but let's get it.
All right, well, let's get it because I thought we was born ready. I thought we was born ready, Brother Kawi. What happened? All right, that's
I'm
all
bracing myself.
Well, as a believer in Islam and with your community striving hard and working with your community, you have your children, you have you also assist with the junior FOI, and so you have a large platform to when I say inform people in the community all of the different levels, different entities in the community about what's going on. How do you keep everything in perspective? How do you inform them and keep yourself on track during these times?
By hanging on every word that the Honorable Minister Louis Farrakhan say. More than anything, more than at any point in time, since I've been in the Nation of Islam, I've been hanging on every word that he say for almost every lecture that he's ever given, and I became more of a reader. So that's is what's keeping me sane in this day and time. So yeah, I appreciate that question, sis.
Yes, sir. Praise be to the God. Yes.
And I wanted to, and let me just continue. First and foremost, I would like to thank you for your continued support of the JAKQ Brothers, and I'm talking about the JAKQ Brothers viewers for each week for supporting us as we continue to grow as hosts with the JAKQ Brothers,
That's right.
striving to make our word our bond in this great. Now, for those of you that have donated to the JAKQ Brothers platform, words just cannot express how much we appreciate you believing in us the way that you do. So once again, words cannot express, but if I had to sum it up, I would just like to say thank you. And for those of you that would like to donate to the JAKQ Brothers platform to continuously to support this platform, please do so. And you can do so by cash apping us, and it's scrolling at the bottom of the screen. It's $JAKQ BROS. Once again, our cash app information is $JAKQ Bros. We trust me, we appreciate each and every dime that we get because it's helping us become better hosts at what we are striving to do. Now, the JAKQ Brothers have an initiative, and we would like to get the JAKQ viewers involved with this. We have an initiative now that we would like to get this information to the prisons. There's no way that our brothers that's locked up can get the word up to date except by us. And so we have a campaign going on in which we're trying to get the final call subscription to at least 100 inmates, our brothers and sisters that's locked up right now. Please help in that regard, in that initiative. And please, if you would like to donate and help us achieve that goal, please donate to our cash app scrolling at the bottom of the screen. Once again, $JAKQ Bros. But in the memo section, put down for our inmate family, so we can know those dollars are going to that initiative. Thank you for that time. And let's get your pen and pad. Let's get some notes that save our lives. Now, back to the show. This sister that I want to introduce to you today, and you've already had a chance to get a small taste of her. Let me tell you a little bit more about our sister. This sister has been a nurse for over 30 years. She's decided to go to the business side of the healthcare industry, where she went there and excelled. And when she went there, she held several positions. She held positions as supervisor. She held positions as manager. She even became a director. This extraordinary sister that we have on the show today has 2 master's degrees in business and is working to get her doctorate in the healthcare administration. Now, she is the daughter of 2 legends, 2 New York pioneers. And she's also the sister of a very protective older brother that just so happens to be a JAKQ brother. With no further ado, and with a JAKQ Brothers round of applause, I would like to introduce you to your moderator for the night, Sister Aquila. I hope I pronounced it right. Bia.
Thank you, Brother Kawi. Whoo, I feel like I've been indoctrined in the JAKQ Brothers community. Thank you so much. All right. Well, My introduction was absolutely fantastic. However, we have two panelists tonight, this evening, whose introductions are out of this world. I want to start. Well, I don't see my beloved, wonderful sister. She might be tending to her beautiful baby girl. Oh, there she is. Assalamu alaikum, Dr. Mayada Muhammad.
Walaikum
Let's give
salam.
her a warm round, JAKQ Brothers round of applause, please. I want to introduce her properly because her introduction is an introduction. Now, it's going to look like I'm reading a little bit because I want to make sure I get everything correct. One word could be used to describe Dr. Mayada Muhammad: resilient. The value of family and nation building was instilled in her at an early age. Mayada always knew Allah would use her to serve her nation, but she never could have imagined where this road would lead her. At the age of 9, her mother was diagnosed with lupus and scleroderma, which piqued her interest in medicine and ultimately led Mayada to pursue a career in medicine. While studying forensic science at Alabama State University, she learned about the Cuban Medical Scholarship Program after reading an article in the Final Call newspaper. Mayada saw this as the perfect opportunity to study medicine, live live abroad and learn a second language. Mayada was accepted into the Latin American School of Medicine, where she would receive an excellent medical education, but more importantly, acquire the skills required to address the biological, psychological, and social determinants of health. Mayada began her studies in March of 2006. Shortly after beginning her studies, the Honorable Minister Louis Farrakhan visited the medical school along with his delegation. Allah confirmed she was on a straight path when the minister held her hand and told her she could do it. Just stay the course, no matter how tough it gets. Go ahead. I'm sorry. These words continue to inspire Mayada for the next 6 years. That's wonderful. Dr. Mayada graduated from medical school in July of 2013 and completed her residency training at Morehouse School of Medicine in July of 2019. Dr. Mayada, I'm going to say that again. Dr. Mayada is a diplomat of the American Board of Family Medicine and a member of several medical associations, including the American Academy of Family Physicians and the Georgia Academy of Family Physicians. She believes everyone has the right to quality health care and education. She currently practices internal medicine at a primary care specialty center in Jonesboro, Georgia. She is excited to serve her nation during the COVID pandemic and beyond. Dr. Mayada is also a member of the Ministry of Health and looks forward to working with healthcare providers throughout our nation to build hospitals for our people. Dr. Mayada's greatest accomplishment is being a mother to her 2 beautiful daughters, Zakira and Zakia Muhammad. That is a bio. Please give my sister, who I love dearly, another JAKQ Brothers round of applause.
I'll praise the good for Allah.
All right. Well, we're just going to keep this rolling because
You don't have any opening words?
Oh, Dr. Miara, did you have a few words to give us? I'm so sorry.
All right. Well, in the name of Allah, the Beneficent, the most merciful Savior, I bear witness that there is no God but Allah and that Muhammad is his messenger. I feel just completely honored to be here today, and I want to greet you all in the greeting words of peace and paradise of Assalamu alaikum.
Wow.
Islam.
Yeah, so thanks for having me, and I'm really excited to share the information that I've been, blessed to receive and my experience with working in our community during this pandemic, during this pestilence from heaven. And I just pray that Allah will guide my words and allow me to share something that will be beneficial and be able to really help those who are in need of information. Thank you.
Thank you. I am sure. I'm sure it will. Yes, ma'am. All right. Well, we're going to continue this uplifting panel here. We have in front of us Brother Hassan Muhammad. Brother Hassan Muhammad started his healthcare career in 1996. He graduated from nursing school in 2003. Brother Hassan has been a critical care nurse for almost 18 years, ICU and emergency department, where he held the position of unit-based educator. Brother Hassan is currently a charge nurse at one of Metro Atlanta's busy urban hospitals. He splits his time working in the hospital and in his own alternative healthcare practice with partners Sister Zenobia, his wife, and Dr. Ascari. He lives in Metro Atlanta with his wife and two beautiful children, Amir and Isira. Please give a JAKQ Brothers round of applause and welcome Hassan Muhammad.
Glory to Allah. Thank you. Praise to Allah. Thank you. I thank Allah for this opportunity and say, in the name of Allah, the beneficent, the merciful, I bear witness that there is no God but Allah, and I bear witness that Muhammad is his messenger. I further bear witness that Allah came in the person for us, in the person of Master Father Muhammad, and that the most honorable Elijah Muhammad is the exalted Christ, messenger, Messiah, and that the honorable Mr. Farrakhan, who saved me, who saved my life, is the Jesus Messiah in our midst. I came into healthcare directly off the Million Man March. And, I thank Allah for the opportunity because, if this was the year 8,400, I would have been a nurse for JAKQ. If it was year 8,400, I'll be sticking pins in the heads of the black babies and, feeding them to a wild beast or cavorting with a cremator, to get rid of the evidence. But I thank Allah that I met the most honorable Elijah Muhammad's teachings through the Honorable Mr. Farrakhan. I thank Allah for my family. I thank Allah for my daughter's name is Sierra. I have to clear that up, otherwise I would get it. Not you, I would get it. But and I thank Allah for my wife, who is my man. She's more than my help me,
Go ahead.
More than my help me. I mean, I definitely would not be here in that line of divine if it wasn't for her, where I'm at right now. Oh. And I thank you, all of you on this panel, for the work that you are doing, because it said our people were destroyed for lack of knowledge.
Right.
The JAKQ Brothers are a perfect example of that aspect that we are missing in our community. The aspect that has an in with the teachings of the Most Honorable Elijah Muhammad and an out to the community. So I thank you for this opportunity, and Dr. Miata for the work that you do. You are a shining light and example for me, and one I strive to be like one day. I'm working. But so thanks for the opportunity, and I pray. Now I have to say to your audience that I'm an emergency room nurse by heart and training, so my mind can go all over the place. So please, I'm glad you have questions so I can stay grounded a little bit.
Yes, sir. All right, another round of applause, please. That was fantastic.
Is that a warning?
May have some toys over there, so don't mind
I'm not sure what was going on just now.
That was the emergency room warning.
Oh, yeah.
boy. Okay. That's whew. All right. Well, our show tonight is to address practical information and tools in case your family, in case your friends, in case you unfortunately are infected with the COVID-19 virus. We want to provide for you information so you know what to do for yourself, for your children, to stay healthy and well. Staying healthy and well is not only what you do after you get sick or after you come down with the illness, most of it is what you do before and how you fortify yourself, what you eat, how to eat to live, how you keep your homes, how you clean, and hopefully you clean often. It's the little things that matter a great deal. So tonight we have our wonderful, wonderful medical experts who are going to give us some of these practical tools to keep you healthy. And hopefully, prayerfully, you share this. You share this podcast and you share this information with members of your community. And remember, this is a community based show for information. If we are not informed, we cannot practice well in anything. So, with that being said, do we want to start with our questions for our
Yes,
panel?
I had a quick question, especially because brothers in the emergency room and the sister's a doctor. Because my physician asked me this, and I know a couple of brothers who had to go to the hospital. The question of did we take did are you vaccinated, and what should our response sound like to a physician when we enter an emergency room? We don't want to get into a debate. So what is a clear, straight response from us entering a medical facility and we're asked if we've been vaccinated?
Uh, if I may start, because I witness that every day. Um, so that is, one of the medical questions that has a new medical question that is asked by every physician or mid-level, which is a nurse practitioner or a PA, of a patient now. Are you vaccinated? And there are some that I've noticed that are heavier with the questions and the prodding and the poking and the urging than others.
Right.
Some are like, "Are you vaccinated? No. Okay. Next question." Others are like, this one particular one, are like, "How come? Let's talk about it."
Right.
And she go all in, say, "Well, you need to look up CDC website and all that." And um, so the answer to the question is this. For us, for me, it's simple. Um, I have a religious exemption. For me, it's simple. I have a religious desire not to pollute my body. And it stems in, as I wrote it on my questionnaire. It stems from the Bible, the Torah, and the Holy Quran. And I went all in of how Allah created man in His image and likeness and breathed Himself into man. So what I am, what you see, is that carrier of the Spirit of God. So I, have been taught, and I believe that I should not pollute that. So for those who have religious a foundation, um, and leaning, it's somewhat simple to answer. But other people, they just don't have that. So, they don't, you know, all I can do while I'm there is to educate the patients as much as I can in a busy, easy.
So, but I mean, if I choose not to get vaccinated and the doctor asks me, what's a simple response? I mean,
Well, you
either
don't.
religiously exempt,
Yeah.
or I just choose not to.
Well, that's one of the misconceptions about vaccinations in hospitals. We don't vaccinate. We don't vaccinate. So you come to the hospital, we're not going to give you a vaccination, even if you request it. We don't do that. You would have to go out on your own and seek that. What they have done is referred you to a one of the drugstores around, without saying any names, to get, or even some of these places where you can get tested from,
Right.
to get
No.
vaccinated. But you're not obligated to get vaccinated.
Right. But they kind of press you with the question. That's what I'm saying.
Well, the question doesn't matter. The
Right.
outcome matters, whether or not you go get it or not.
Right.
I mean, they don't. No one's forcing you to go get it unless it's your job. But nobody's forcing you. The doctors can't force you to go get it. They can just tell you that it's they can give you the CDC evidence. But the question is just a question. You can either say okay or not, and you be on to the next one.
Yes, sir.
Do you understand what I'm saying?
Yes, sir. Yes, sir.
It's just a question. You don't have to, and it's a direction. You can accept it or not, sir.
Yes, sir.
Yes, sir.
All right. I'd like to add to that. So, I mean, you do going in. I don't feel that as someone who isn't vaccinated that you should feel afraid to say that you aren't vaccinated, because at the end of the day, no one can force you to get vaccinated. It's your own, personal choice, especially when you go into a healthcare facility. I've had doctors, I know doctors who have sat there, and nurses who have sat there and just had these long conversations with their patients. Okay, why are you not getting it? Because right now the healthcare establishment is being told that everybody needs to get a vaccine. So you are going to have people who are going to want to have these lengthy conversations with you about why you should be vaccinated. If you say that you aren't vaccinated, but you don't have to go through that. You can just let them know, hey, I have my own reasons for not doing it, whether it's religious belief or your own just personal reasons why you don't want to get the vaccine. And you can just tell them that you don't want to have that conversation so that you don't have to put yourself through that. Because if you allow it, you do have a lot of people in the healthcare field who will sit there and go on and on and on about it, even your physician. Now, for me, I do ask some of my patients if they've been vaccinated. Really, it comes up in the chart a lot of times whether the patient has received the COVID vaccine or not. Sometimes it's accurate, sometimes it's not. For the people that I ask about it, a lot of times, depending on what symptoms they're having, I want to know if they've had the vaccine, because a lot of times I want to see had they just been vaccinated, because sometimes people do get some adverse reactions to the vaccine itself. And so if they come in with certain symptoms, they tell me that they having some swelling up on their arm, or they just had this fever, and I'm like, okay, well, when were you vaccinated? Did you get vaccinated? And just like to kind of give me some more information to help me make a diagnosis. Also, just to have some information about the amount of patients who have been vaccinated and who are contracting contracted COVID after being fully vaccinated. That's just more information for me, just to kind of get a sense of, okay, how many people are being quote unquote protected with this vaccine, and how many people aren't and actually, getting the virus after they've been fully vaccinated. But you don't have to have those long conversations. Just tell whoever's asking or trying to go into that with you that you don't want to get it for your own personal reasons.
Thank you. Thank you. Thank you, Brother Hassan. Well, I don't know if a question or a statement, but I'd like to say just dealing in healthcare for so long, you do see how when people are afraid, when the community becomes afraid, either they become paralyzed or they leap into action in many different ways.
Yeah.
When you see people or patients come into the emergency room, Brother Hassan, or into your office, Dr. Mayada, and they are afraid, what do you tell them to help them to deal with that fear? Because when people are afraid, they don't always want everybody to know. So they hide it, they mask it. How do you help them to deal with the fear of today and
Good
what's
question.
going
My interaction with patients in the emergency department, if they're real true ER patients, that is limited. So what I have to do is bring a higher level of spirit with me to them. Um, and I've been in this, many years, so I noticed the way you approach the situation with the patients does a lot about alleviating stress, you know, worry with them. You but that's for that patient. Now we do have in ER because of COVID, we have patients who should be in the ICU or should be upstairs in some other admitted room, but because we're the house that the inn is full, so to speak, they can't go upstairs. So we have patients, ICU patients. We've turned into ICU nurses for the most part. We've turned into med surg nurses for the most part. So ER nursing is it's a dying field today. We're becoming jacks of all trades. So again, it's how you approach even that patient, because they are the ones who on, who are on the vapor therm, on the BiPAP or CPAP, and vapor therm is a nasal cannula of oxygen going through a nasal cannula with humidified air, humidified oxygen going through your nasal cannula at high levels of 40 liters per minute, or non-rebreather masks, or I mean, so you have to show a level of understanding, compassion, and this is what we strive to bring.
Yes, sir. Thank you. Dr. Mayada, did you add to that?
Yes, ma'am. So the first thing I'll say is before I enter a patient's room, and before I go in there, just like try to make sure I'm bringing a calm spirit into the room, bringing a calm energy into the room. And people feel more comfortable when they're with somebody that they trust, even if they don't know you. If you come in and you have a certain spirit that you bring into the room, that in itself can help to just calm a patient. A lot of these patients, they are suffering from a lot of anxiety because of all this information that they're receiving, and so you want to provide patient.
All right, all right.
That's all right. We lost her, but we didn't lose what she said. So we heard her. She brings a calm spirit when she
Right.
deals with her patients. And that's wonderful. And the patients need that. They
Yes.
need to be calm so that they can relax and open up and talk to the healthcare professionals.
Right. She's coming
Is she coming back on?
There
There
she
she
go. There she go.
Oh,
All right, yeah, it just stopped. Sorry about that. But no, I was saying it's the education, educating our patients, my patients, the community, because knowledge is power. Once you have information, you get a sense of what's really going on, and you have someone to just reassure you that you watch the news and it makes it seem like everybody's going to die. If you get COVID, you're going to die. And the first thing I tell my patients is that, most patients get this disease and they recover. They recover from it, the majority cover. And so just will recover from it. So just from them getting that information, and I let them know that, it's a smaller percentage of patients who actually are dying from this. Letting them know that there are things that they can do as far as just trying to optimize their immune system, eating healthy, drinking water, exercising, getting good sunlight, trying not to have so much stress, that those things alone can really help to protect them from from catching the virus. And if they do catch it, that the body itself can heal. It can heal itself. And that's the thing that a lot of patients don't even consider, the fact that my immune system actually works. God gave me an immune system that
right.
fights off viruses every day, fights off different types of bacteria. And so I tell them that, like, hey, the coronavirus itself, that was initially, it was the primary cause of a common cold. I remember that from medical school. So when I learned that a coronavirus was killing people, I was like, what? And I have that conversation with them, but I say, a lot of times we get the cold, we get past it because we have an immune system that can fight it. God gave us natural immunity. And so let's just try to optimize that. And a lot of times, just from having that conversation with my patients, I can just see them become a lot more comfortable. And you can see that the fear is starting to subside once they're educated properly.
Thank you. Fantastic. Brother Kawi, did you have something to say?
Yes, ma'am. Yes, ma'am. I work. I don't work with a lot of sophisticated folks like Sister Mayada and Brother Hassan. So I'm gonna ask you some simple questions. You know, where I work at, I mean, it's a big battle between the vaccinated and the unvaccinated. It's a battle, and the vaccinated, they have their points. The unvaccinated have their points, whether you a believer or not. And that's the number one conversation each day. So my question to you is being vaccinated building our immune system up to the point where we would not get COVID-19? We already know the answer, but let's just for I'm trying to lead up to another question.
Uh, I haven't noticed patients coming through who have been vaccinated and are COVID free. In other words, there are patients who come in who have both vaccines and still come in with coronavirus. There are patients who are sick, who've had both vaccines. I tell people when they tell me, I didn't have coronavirus. I got both vaccines. That doesn't matter. You can still get coronavirus with both vaccines. And I say, kind of wonder what it was for, huh? What's the point? You know. So no, I mean the evidence is as you say, we already know the evidence is clear. It doesn't protect you. That was I think a line that they used to get people vaccinated. Um, but evidence shows that that's not the case at all.
All right. You want to chime in, Dr. Maniata? Or you good?
I'm good on that one.
All right.
Yes, sir.
So the question is, since the vaccinations aren't protecting us in our immune system, then what can protect us and build our immune system up to the point where we have a little bit more defenses against this virus? What can help us?
I'll let Dr. Young start with that one.
Yes, sir. All right. So, as I said earlier, we have our own natural immunity that was given to us, by Allah. Our body is designed in a magnificent way to fight off disease. And in order for us to be able to do that and do it efficiently, we have to make sure that we're giving our body the proper fuel and the proper nourishment. And unfortunately, that has not been happening because, we do not know how to live, many of us, our communities. And so the first thing that you could do, and the most important thing you could do, is make sure that you are eating the proper food at the proper time, that you're drinking adequate amounts of water, that you're getting as much sunlight as you can so that you can get that natural vitamin D from the sun rays, but if not, that you're supplementing with adequate amounts of vitamin D, that you are taking vitamin C supplements, you can take zinc supplements, but really it has everything to do with diet and weighing properly. I'm noticing that many of my patients who have more severe disease and end up in the hospital and the ICUs, even if they're younger, are patients who weigh 200, 300, 400 pounds. And so that's a very important part, is to make sure that we are really taking the time out to, at this time, be as healthy as we can be, get as much exercise as we can get, and eat as healthy as we can eat. Those things will help us to optimize our immune system so that when the virus comes along, if it does, we can be ready to fight it off. That's really the most important part of prevention. We want to prevent disease. Of course, there are medications that you could take that have potential to be a prophylactic, to help you from contracting the virus. But again, our body was made to be able to fight off most disease. And if it does come up under attack and we need a little bit more assistance, then of course there's certain things that we can do in that case. So that's my quick answer. I'll let Brother Hassan go from there.
Right. Yeah, I want her to give a real positive answer first before I say something. So it's been my experience, that one of in my bio was mentioned that I do alternative health also. So one of the tools that I use is a food journal. So I've seen many of the believers, our nation, in our nation, and many people who aren't believers, and I see our diets, and when you going 100 miles an hour, and the wall is like 10 feet in front of you, it's kind of hard to hit on the brakes with the momentum you have and stop from hitting the wall. So I mentioned before about this body being the machine, or being the carrier of the Spirit of God. Each thing that we eat, of each proper thing that we eat, our body breaks down and nourishes. It breaks down and distributes it. However, if we've been eating improperly, or we've been eating foods that don't have what our body needs,
Yes, sir.
what happens is our body starts to malfunction. So you may look good, you may be a perfect specimen of a human being, but internally there's nothing there, and that's the way the food is made, because the Most Honorable Elijah Muhammad, like he said in the book, they commercialize everything. So they have to put things in the food to make it look appealing, but it really is empty empty nutrition. It's nutritionally void. So it's kind of difficult, and this is why this whole pandemic has proved to me the efficacy of the teachings of the Most Honorable Elijah Muhammad in diet and in life in general. Because how to eat to live is absolutely a science. So what we need to do more is get that word out. I see a lot of people, man. A lot of people come through the emergency department. Their diets, are totally not in, and they're young, and they're having all of these. Let's put COVID aside for a second. Back in the when I first started in this field, there was such a thing as old people's disease, diabetes,
Right.
hypertension,
Yeah.
end-stage renal disease, on dialysis, cancer. That used to be, them old folks. Now I'm seeing in young people, a brother, 46 years old, yesterday, before I left work, we coded him. He had a heart attack.
Wow.
And he didn't make it. 46 years old. His heart enzymes went from 0.05, which is 0.04 is the cutoff, to 12.
Wow.
Yeah. So he had a massive MI and died, a heart attack, and died. But he is not the exception anymore. He is more so the rule. So for us who have been indoctrinated, if I can use that term, bathed or baptized in the teachings of the Most Honorable Elijah Muhammad, we should be living, walking, breathing examples of the efficacy of this teaching.
Preach, brother, preach.
We should be, and I see too many believers coming through. I've taken care of too many believers. As a nurse and as someone going in just to take care of, I've taken care of too many, and it's because we falling out. Another thing we can do, as mentioned for COVID, proper hygiene. Proper hygiene. You know, we wear our masks. We got our masks on like this. What coronavirus is? Coronavirus, it goes, it houses in the nose, the nostrils, the nasal pharynx, the nasal and the nasal pharynx. So we don't want to. We get lazy with the mask and have it down like this, and all of this is exposed. You know, all in our nostrils, right where coronavirus lives. You know, washing hands. You know, I mean, it's been a long pandemic. I'm a bearer witness of that. It's been a long pandemic. You know, it's even longer for me being out there on the front line, seeing this every day. You know, and having to wear masks, like, you know, all shift and then some.
Yes,
You
sir.
know, you know, so you know, but we have to be vigilant until you know, Allah brings us out. However, our diet, or how to eat to live, is something that builds the immune system. You know, and I say it's a science because there's some things that bacteria, that pathogens need to survive within the system. They need moisture. They need a pH balance, whether it be alkaline or acidic. They need that neutral one for them. You know, and they need food source. And the more we eat food that doesn't have anything in it that our body has to fight against, the more we do that, the more we offer an opportunity for something else, an opportunistic infection or virus to get in the back door and cause wreaking havoc. You know, the virus is just a parasite.
Brother Hassan, there's a buzzing noise. You gonna make sure your microphone is plugged in all the way? Yeah, there's like a buzzing noise.
Is it still buzzing?
No.
Okay.
No. Well,
I got a question for you, Dr. Hassan. How important is sleep? I'm sorry. Can you hear me? I'm sorry. Did I
No.
cut
I heard you. No, I heard you.
Okay. Yes, sir.
Sleep is very important. You know, we have two different systems. We have a sympathetic and a parasympathetic system. So the sympathetic system is like stepping on the gas. You know, you step in the gas, it's like getting out the bed in the morning. You want to be on that sympathetic system. You want to be able to go. You know, you don't want to be stepping on the brake, sluggish. You know, which many of us are in the morning getting up. The parasympathetic system allows you to rest. So you want to be on the brake during that system. However, if our parasympathetic system is disrupted, then we're unable to rest. And if we can't rest, that's when the body heals. That's when the body pulls itself together, gets rid of a lot of the waste, or prepares to get rid of some of the waste. And that's why in the morning you have this long urination, hopefully, you know, to get rid of some of this waste that was built up. So rest is very important. Sleep is very important. In fact, I think on one of the protocols, melatonin is you know, prescribed to give, so it's suggested to take to help you to rest, so that your body can heal itself.
Yes, sir. Yes, sir. I wanted to really dive into that.
Sorry, Brother Ahmed, can I interrupt you? Because the other part of the JAKQ brothers has arrived. Can we make sure that we recognize with a JAKQ brother round of applause, Brother JAKQ Muhammad? Great to see you, Brother JAKQ Muhammad. Oh, we can't hear you.
Apologize for being late, family.
Yes, sir. Assalamu alaikum.
Wa alaikum salam.
Wonderful. All right, Brother Ahmed.
Okay. I wanted to get into the mucus and how the mucus or the inflammation of our internal organs are dealing with this. I listened to a doctor saying that it's not the virus, it's the inflammatory response
Right.
that the body is trying to clear the virus from the body. It's causing lung damage and respiratory failure. Was that the mucus buildup? Because when they tell us to go home and quarantine for 2 weeks, are we still dealing with inflammatory responses in the body, causing pneumonia and lung disease?
Yes,
That's
sir.
thank you, Dr. Matta.
All right. So whenever the body is under distress or it's attacked and you have any damage to your cells, our immune system kicks in to basically try to fight off infection, to repair whatever damage is being done to our systems, to our organs. And so specifically with the coronavirus, a lot of different organs are involved in that, but I guess right now we'll pretty much focus more so on the lungs. But inflammation, that's normal to have an inflammatory process to happen to try to repair. But a lot of times when that inflammation stays around too long and those cells are there for prolonged periods of time, they're giving off a lot of different substances and they start causing more damage. They start causing damage if they stay around for too long. So that's what the whole, how can I say, overactive immune response, or in this case specifically with COVID in the lungs, they call a cytokine storm that's happening, where you just have really high amounts of inflammatory cells and markers that are there that can be protective and help us. But again, if they're there for too long, they can start causing damage. And so that's why you end up seeing patients, or we end up giving patients anti-inflammatory medications, but we don't want to give them too early, because again, that response is healthy at the beginning of COVID or any disease. But again, if they stay around for too long, then you start having these prolonged symptoms. You start having, I apologize. You can develop a pneumonia, but if the pneumonia is staying around for too long, then okay, now you need to have some steroids possibly, or some anti-inflammatory medications like ibuprofen to try to decrease that inflammatory reaction so that you can begin to recover. And so, yeah, you can form mucus and have production of mucus during that inflammatory response. Our body, it makes mucus in, how can I say, smaller quantities, which can be normal because it's helping us to clear our airway. We have like little small, how can I say it, like little small furs inside of our lungs to help us clear things, or not from our lungs, but from our airway, to help us get it out in the cough and get, things that shouldn't be there out. And you have some mucus, but the thing is, when you get a increased buildup of that mucus, then those cilia don't work to help you get things out. So now we're saying we have to give you some medicine, take some Mucinex or something to help thin out that mucus. Drink more water to thin out that mucus so you can get it out of your system. So that's my response. Something you want to add, brother Hassan?
Oh no, that was perfect. I mean, I see the prescriptions that are handed out to our family who have the coronaviruses, and steroids is one of them. And it depends again, because not everybody comes in with coronavirus has some respiratory issues. Some are just fatigued, some are weak. Some have nausea, vomiting, abdominal pain. So not everybody has respiratory involvement. But for a lot of those that I've seen the non-steroidal anti-inflammatories or the inflammatories and the steroids being passed out. Yes.
So let me ask a question, Brother Hassan. What happened to the flu? Do anybody have the flu anymore, or is everything coronavirus?
There's been a few flu cases, but flu season's coming. Just brace yourself. But last I guess last flu season, it's tricky because everyone's wearing masks. Well, not everybody, but a lot of people was wearing masks at that particular moment. So the flu count was down, and that may have been a result of the mask wearing. You know, um, but they're still urging to get your shots. Just
They are.
yeah, they're still urgent. But I think that for those who are not wearing the mask, I think the flu is going to be back. It's going to be noticeable for those who aren't wearing masks. But a lot of us are still wearing masks, and a lot of us aren't. So we'll see.
Okay, so I lost some members in Florida due to the coronavirus,
Sure.
and the symptoms that they were complaining of were basic coughs. Um, I have a cough. Um, how can you tell, or can you tell if I'm at home and I'm trying to do home immunity? Can you tell the
Nah.
difference?
Today, bro, if it looks like a duck, quacks like a duck,
Right.
assume that it's a duck. Even if it's square shaped,
Sure.
But nowadays you just don't know. We used to talk about patients coming to the emergency department for stuff like that. But if you have, there's some things you should have in your toolkit. You should have a thermometer. You should have an automatic blood pressure cuff. You should have pulse oximetry. You should have these things, along with some food to last 3 months at least. So I mean, you should have, and water. You should have these things. Now, if your oxygen saturation, I mean, a cough is a cough, right? But you ever heard of that book? Men are from Mars, and women from Venus. You ever heard that book?
Yes, sir.
Right.
Yes,
So
sir.
I find that to be true. I find that in the hospital,
Right.
the only time men are there for the most part is when they're in their cave. They
Yeah.
couldn't. They just couldn't figure something out. They couldn't get any honey to put on. They couldn't. They couldn't get any salt thrown on. It didn't work.
The last
So the last resort is coming to the hospital. Stuff coming from everywhere now. And they on the last shoestring. And it's kind of too late. But that's how I find out. That's how a lot of people find out. And they don't survive because they wait. But if you have some things at home, if you have these things at home, you at least have a chance. Because if your oxygen is like above 92, according to the pulse oximeter, and I preface that by saying, okay, your oxygen's above 92, but you're not really short of breath when you move. If you're not struggling. So if you have a cough and your oxygen's above 92 and you're okay, you're not having any fever. Yeah, I mean, I would say you can, you're good. Just be vigilant. Just have somebody that's checking on you. But hey, man, Allah's God, things change in the twinkling of an eye. So you make sure whoever checking on you is checking on you.
Right.
I mean, they're committed. But yeah, it's you just have to have those basic kits.
Okay, I'm sorry. I know someone was finna say something, but can you explain that pulse oximeter?
It's I don't have one. I have one in my.
I have one.
It goes on you. You put it on your finger, and it shines a light through your fingernails or your finger, and it checks the oxygen level. There you go. He's showing right there, and also your heart rate.
Yes.
Okay.
Okay.
Your heart rate and your oxygen level that you have. So again, if it says 90 below 92, with any not with any difficulty or struggling or difficulty in breathing or shortness of breath when you walk or exert yourself or talking, all of that stuff you need to come up to the hospital. you know.
Oh, okay.
But if you're sitting there and says above 92 and you good, you flying, you say, oh man, it's 92. And then you fine, you know. But still have somebody checking in on you and you checking out on you, you know, to them, you know. So
And this is the new home kit, because it used to be just Band-Aids, Neosporin, and a few other things. But now, if we're gonna challenge and fight this, we have to have these in our toolkit, right?
right, because I can't necessarily look at you and tell you got coronavirus, you know. And a cough just may be that, maybe a common cold, which is a coronavirus, but it's not the COVID-19 coronavirus.
So, I'm sorry.
So, you know, we have to make sure that because it affects people differently.
Yes.
It affects people differently. So if you have any respiratory involvement, though, that's a concern.
Well, should it be such a concern when I say, hey, I'm not feeling good? I mean, in this day and time, we should break out the whole kit. When somebody's saying, hey, I'm not feeling good.
Yeah. Whole kit. You meaning you need to take your temperature, you need to check your oxygen level, you need to check your heart rate, want to check your blood pressure. You know, if you have an option to check your blood sugar, you know, because today, you know, the way we eat, you can check your blood sugar too.
Yes, sir.
Then, you know, then that's a good start, you know. But sometimes people can see you, you know, better than you can see yourself. And if mom says, "Yo, you don't look too good," if your son says, "Yo, dad, you look horrible," your husband, your wife, whatever, if they see you, look at you and say, "No, you don't look right." Sometimes we have to defer, we have to put our ego on the shelf there, our pride, and you know, because our life is more important than that, and allow them to take us to be seen. And
Right.
again, we got to come out our caves as men. We got to come out those caves.
It seems that we're just waiting for, well, okay, we're trying to deal with this virus like it's a common cold, but it's not. In some cases, if we're dealing with it like it's something bigger, I think, is that the safest way to go, instead of just, hey, just eat some soup or drink some tea? No. If you're not feeling good, we need to check everything right now.
In
You
emergency
should take your
medicine,
symptoms serious. Yeah,
yes,
take your symptoms serious, and like Brother Hassan was saying, you really want to monitor yourself and make sure that someone is monitoring you as well. And if you start feeling that your symptoms are progressing, so at first you just started off, you had a little scratchy throat, maybe a little cough, but now the cough is getting worse, and you're starting to have stuff coming up when you cough. You're having chills, you're feeling short of breath, energy levels just going down. All right, something more is going on. You don't want to wait around. You want to seek medical attention as you notice that your symptoms are starting to progress more and more and more. What I'm finding in some patients, they would have had these symptoms for like a full 2 weeks. They were getting worse.
right.
And then at the moment where they literally can't breathe anymore, now it's like, oh, let me get an appointment with my doctor. And I'm like, even an appointment at that point, no, you should be going to emergency department or.
Yeah, yeah,
But that's what I was saying.
right.
You know, as far as the average person, look, I can't even wait. If
Right.
somebody, if I'm living by myself, or if one of my family members is not feeling good, hey, we need to take this serious,
I agree.
because
And that's how I do.
I'm not a medical person to say, okay, you're getting worse, so we need to go now. Those 2 weeks could be life or death.
Right.
Absolutely.
I agree.
Absolutely. Brother Hassan, you spoke about fortifying your immune system. You spoke about vitamins that you can take, and so did Dr. Yada. You spoke on you mentioned several of them. Vitamin D3, you mentioned zinc, and you mentioned vitamin C. And all of those can be obtained at any drugstore. And so can all of those instruments that you can use to check yourself at home. A thermometer, a blood pressure cuff, a blood pressure machine. They have electric ones that you can put your arm in, press the button, the pulse oximeter. Is there anything else that the community can do at home? Because we want to speak about practical things. We want to speak about the regular person that you bump into at the grocery store, that may not have any medical background at all. And they just want to make sure they're okay. It could be they have seasonal allergies and they don't know how to decide what's what. Is this allergies? Is this the flu? Is this corona? How can I kind of check myself before I run to the emergency room and expose myself to everything that's happening in the emergency room today?
Well, a lot of people come to the emergency room being already exposed. So, but, the answer, just some things. I heard today that, pretty much coronavirus kind of settles right here, right? So I heard that if you dilute Johnson and Johnson's baby shampoo, and you can kind of, clean your nose out with that, and that helped. That's helpful. That came from FLCC, critical care physicians who are pushing ivermectin and also other ways of treating coronavirus. Mouthwash, Listerine mouthwash, cleaning out your mouth, that kills the coronavirus in your mouth, those are two practical things, along with the other hygienic things that we use. And yes, in eating, how to eat to live, normally, if it wasn't for coronavirus, normally I would advise my patients that see me to take in more whole food vitamins, because you have the synergistic effect of all the other vitamins and minerals that go along with that to activate that. So when you take high vitamin C or any other isolate meaning it's like a car, right? So you have a car, that's the whole vitamin. You got everything working together. But when you take a part of it, an isolate, it's like I'm giving you, instead of giving you the whole car, I'm giving you the steering wheel and saying this is the car. Ascorbic acid is like that, or vitamin C. Today's ascorbic acid is like that. It's really part of the vitamin C that protects it as an antioxidant. It's that aspect of the vitamin C, which vitamin C comes with other minerals and nutrients that make it work, But since that's the protective factor of vitamin C with itself, they've taken that aspect out and put that into a pill and said this is vitamin C, and made it an antioxidant. So that's like giving the steering wheel and saying you got the car. So normally I would say, get whole food vitamin C. We are in the pandemic season, and for pandemic reasons, sometimes you need that extra high vitamin C anyway. So that's fine. So yes, those vitamins and that are touted that we should get, and many of us are. I mean, many Black folks are lacking in vitamin D. We don't go outside no more. This whole young generation don't even know what the sun look like. I gotta make my children go outside. So we need to get outside more, because I'm at work. Only time I go outside is take a patient to the car. So we all have to get outside more and soak up the vitamin D, and it helps to go to Africa. Plenty of vitamin C, vitamin D over there, so yeah, we a lot of just you have to eat better. In other words, we had how to eat to live. If you haven't got the book, if you don't know what that book is, it's written by the Most Honorable Elijah Muhammad. It's volume 1, volume 2. We have to get that book. It's science to it, because we don't understand the level that our bodies are in or left in after 400 years.
Yes, sir. Yes, sir. And if anybody, I'm not sure, put that where we can purchase How to Eat to to, you can go to www.noi.org for our viewing community, www.org, and you go to the bookstore and you order and purchase How to Eat It Book 1 and Book 2 and educate yourself and save yourself. Thank you, Brother Hassan. Brother Miata, did you?
So I have a question again.
Well,
I
call
hope
we,
it doesn't drop me.
she just asked Miata, Dr. Miata, if she
Oh,
wanted to chime
I'm sorry.
in.
Go ahead. I'm sorry.
Oh yeah, the only other thing I'll add it with vitamin.
Is that her? Is that her? I think she froze. Okay.
She did. She froze.
She froze.
Yeah.
Okay. What, Brother Hassan, there's a question from a guest. He asked the question if should we be concerned with whatever we put on our skin, by the
Yeah,
skin being the largest
yes,
organ. Should
yes.
we be particular about the certain soaps, lotions, deodorants, and so forth?
Right, right. And you know, that's a wonderful question. Not just soaps and all of that, but also some jewelry that we put on, certain clothes that we put on, because a lot of clothes not made out of cotton anymore. You know, it's made out of some synthetic material. So our body is the largest organ. In fact, our skin, should I say? And when the skin is forming in the womb, the skin has a direct link because it's the same material as the brain forming. So it has to be the same to be able to communicate with the outside world. So that's why it's direct connection. So, and it senses things from the environment. And sometimes when we put these oils on, or some perfumes, or that are highly petroleum based, our body recognizes that, and it goes and it shuts down. So yes, all of we have to be careful, and sometimes you don't know it until somebody does like maybe some muscle testing on you, or you feel a certain type of way. You come in for an assessment, and we find that, okay, yeah, it's this or that that's causing it. So yeah, the skin is very important, but unfortunately, we live in a polluted world. So we just have to stay as clean as possible on the inside.
Is that why the epidemiologists are now becoming more vocal?
As far as
In the beginning, you wasn't hearing much about them, but nowadays, they're speaking more about the vaccine, and they deal with more of the skin and the different layers of the skin.
no, no, they're statisticians. They're not. They're not those who deal with the skin. You um, maybe they're having maybe a lot of people in government. They have a conscience too. Just like I don't want people to think that those people in healthcare are all we're all drones who believe in the propaganda that that's put forth. Many of the people, nurses and doctors and whatever qualification that I work with, you know, are do a wonderful job of taking care of the patient. I don't care if they're Caucasian, they're Black, Hawaiian, Hispanic, whatever. They're many of them are a pleasure to work with because you can tell that they care. They're there for a reason. Um, so many people they're not with the same swallowing the propaganda. A lot of nurses don't want to get vaccinated. A lot of doctors don't want to get vaccinated. Many of them are between a rock and a hard place. They have to feed their children. They have a mortgage. They have a, you know, children are in school, or they're trying to live themselves. So this system has them cornered. You know, and I thank Allah for the teachings of Most Honorable Elijah Muhammad and Abu Muslim Farrakhan, that he's given us a way out. With the nine ministries. If we would but um, take heed and work it as it should be worked, we would have to worry about them threatening our job. You know, we don't really have to worry about it anyway because Allah is God, and He has a way out for all of us if we but believe that. But
Believe that. Come on
yeah,
now.
but many of us who don't have that faith, we are stuck. So we have many people in healthcare, man. Many people who really want to do the best for the patient.
All right. So
But
so
okay.
so my question was this: um, the hospitals are very full these days, and there are a couple of people that I know they are self quarantining because they said that they can't get in to get seen because
Right.
the hospitals pretty much, unless you're dying, they're not letting you in.
Right.
What can a person do to get past that barrier? What can you advise? So, like, if you feel that, man, this may be it, and I need to get seen,
Yeah.
and what can you do to get through those emergency doors?
I can't say that they're not letting you in. I can say from my experience that we're not letting you in. What's happening is that they have 200 rooms or 60 something rooms upstairs, 200 something rooms upstairs, and all of them are full. And what we have is, so no one else can go upstairs, but we have a couple of doors open in the emergency department. We have the EMS door, the ambulance door, and we have the front door. Those doors don't close, you know, but we'll have a limited amount of space in the emergency department. We may have 60 beds, and if all of, and at times, I would say 58 of those beds, 50 of those beds are with patients waiting to go upstairs, admitted patients. So we have a limited amount of space to work with in patients in the front, to take care of patients in the front, and hopefully they're ambulatory. In other words, they can come in and be treated and go out. You know, um, so the best thing to do if they need to be seen is just come in, walk in. You know, if you're really that bad, call an ambulance. But if you're able to have somebody bring you, I mean, it's best than to just stay home. And many people have stayed home during the first iteration of the pandemic. Many people died at home because they didn't want to come to the hospital because of the fear of the coronavirus. So they stayed home and died. Whereas our emergency room were empty at that time because no one wanted to come to the hospital. No one. It was like ghosts.
Hmm. We had two questions from the audience. One was, do you have any reports where the vaccine shots weaken the immune system? And the other one was, can you buy these steroid medications over the counter?
I don't know any of the steroid. You can't buy any steroids over the counter that were given via prescription. You won't be able to do that. But I wouldn't, as a layperson, I wouldn't want to take those steroids unless you know what you're doing. You know, because what a steroid does, it by essence it decreases inflammation, but it could also lower your immune system. So you have to know when exactly to take that medicine. We have patients who, borrow another person's medication, be it diabetes medicine, be it antibiotics, and you know, you put yourself in a pickle by doing that. because if you haven't studied the chemistry of it, if you haven't studied the mechanism of action, you don't even know if it will work for you or what it's going to do to you. But because it works for them in a certain way, it doesn't mean it's going to work for you in the same way. And some antibiotics are given for different reasons. So steroids, if it's given to you, if you're getting steroid at the wrong time, you can make the situation worse, as Dr. Miyata was saying, because they give steroids at a certain time in the treatment of coronavirus. So if you're taking it too soon, or something else is going on with your body that you're not aware of, you can do yourself more harm than anything.
Now, the other one was, have you had any reports where the vaccine has weakened, or did you just answer that?
Well, no. There have been patients who, according to the CDC, have died as a result. So, I mean, nothing is not foolproof. I had, this is a correlation, it's not a causation, but I know somebody who, an avid runner. I mean, he is in shape, and he's always been in shape, and he works in healthcare, and he was helping his daughter put together a bed frame with a screwdriver, screwing in some screw, and he felt something go pop, and he had a ruptured tendon. I mean, this is somebody who was in perfect health, but a ruptured tendon out of where? Where did that come from? I mean, in great shape. Now, I'm not saying that's the causation, but I'm saying it makes you say, wow, really? Just for a screwdriver, just for screwing something, But there's evidence out there, according to the CDC, of all kinds of things happening with the vaccine, with all vaccines. Yeah.
So I have a question as well. So the biggest craze going on right now amongst my family and friends is sea moss. What's the? I mean, is this something that could really help in building your immune system up? This sea moss. I haven't heard of sea. I mean, it's just like this. It's been around like the last 2 or 3, maybe 4 years, and it's like the most popular, like little supplement you can get now. So, can you tell me anything about sea moss and what it can do to help you, if it can help you at all?
Everything is kind of situational and individual. Well, sea moss is, the biggest thing about the sea is the minerals. This is why we're told to get sea salt, real sea salt, because real sea salt has minerals that come along with the salt, and they help to activate, because your body, it thrives, it works off of minerals, macro minerals and micro minerals. That helps your cells to function. So anything, too much of a good thing could be an issue, particularly if we talked about the parasympathetic system before. The parasympathetic system, that which helps you to heal. The sea moss and minerals, that calms you down, allows you to heal. But if you're already in that mode too much, then you could be working yourself. You could be working against yourself. So we use in our clinic, we test things on an individual basis. Modern medicine is, and this is a little bit what you're speaking of, it's the latest craze, sea moss. Modern medicine, that's how modern medicine works. If you came in with chest pain, then there's a system of things that we would do, and everyone gets the same treatment. We find out your blood pressure, so everyone gets put on maybe hydrochlorothiazide, which is a blood pressure medicine. Everybody, you, my wife, your son, whoever, will get put on the same treatment. So it's modern medicine is a linear equation. This hurts, therefore it's got to be that. But in reality, things work different for different people. So that same medication may not work for you, may not work for your cousin, may not work for we have to see what your body says, and that's what we do in our clinic.
I see what you're saying.
So CMOS, yeah, it may work for some people, and it may make you feel good in some instances, but we have to see in the long run.
Can I ask Sister Dr. Mayada about that?
Please.
We got you now. I'm going to get a question in quick. Now, I just asked him about CMOS. I mean, that's what everybody asking for. Have you had that? Have you had patients ask you, do it work?
Yes, sir. So, a lot of patients are taking are on the CMOS. I don't particularly recommend it because it's just not a part of the protocol that I follow. The protocol that I follow normally is going to be the vitamin D, the vitamin C, the quercetin, and zinc and melatonin. Outside of that, I don't really make too many other recommendations just because, based on research studies, those right there are like the best supplements right now to help with the prevention and the treatment of COVID.
Yeah, it's very interesting it's very interesting also. It took me a minute to realize that even though I've been working for I don't know how long, how many years with this coronavirus now, 2 years or a year or so, but they're treating coronavirus in a hospital now with vitamins. Isn't that interesting? I mean, isn't that interesting? I mean, they're getting the vitamin C. I'm getting the vitamin C. I'm giving the vitamin D. I'm giving them the Theragram, which is a multivitamin. It's very interesting. Now, see, if we would have started out with that, would we need to be in a hospital in the first place?
Right. Now, I also have a brother that and he put a shameless plug in there. He about the raw milk. So, Dr. Mayada, in terms of raw milk, how can that help you in terms of building up your immune system strong enough to fight this virus?
Yes,
or can any milk help you?
So raw whole milk is going to be the better milk in general because it hasn't been pasteurized and filtering out all those enzymes that we actually need. When it goes through that pasteurization process, a lot of times we lose a lot of the nutrition or we break down those enzymes that are naturally in the milk that can really be beneficial and provide nourishment to us. So again, I haven't read a lot of studies on it, but I know that we were told to consume that type of milk opposed to the pasteurized milk and what you typically would get in the store. So it most definitely has health benefits. And based on what we get from How to Eat to Live, anything that's in that book that tells us to do is going to be helpful to us right now. Of course, including fasting. That's something else that's very important. I was listening to a lecture a couple of weeks ago, and they were talking about intermittent fasting was helping patients who had long COVID. And they actually recommended for patients who have long COVID to help them to get past that. And so again, that's bearing witness to the teachings of How to Eat to Live, because intermittent fasting is basically eat one meal a day. And they just called it that. So again, anything that has been given to us in How to Eat to Live right now, that's what we really want to follow to help us, to assist us in during this pestilence.
Right.
That was excellent. Yes, ma'am. Mm-hmm. Well, I'm not sure if I was going to go to commercial break at this point.
No.
All right, keep it rolling, because this is really, really good information. And I almost lost track of time just listening to Dr. Mayada and Brother Hassan, because even though I'm in the health field, there's a lot of questions that are being asked, and you want to hear different ways you can address it so that everybody can understand. Most of the times we're taught to not speak baby language, but to speak on a 5th or 6th grade level so that things can be easily understood.
Right.
And this community podcast what we're speaking about tonight is making things very easy to understand. It's making it nice and easy to digest, very digestible information. So I just wanted to say that I'm enjoying writing
Yes, ma'am.
writing down a couple of little points here, and taking it all in.
I
So,
was
so
earlier, I got disconnected. I wanted to add one little tidbit in that I recently learned about vitamin D. Um, or something I noticed about the levels when they check it when you go see your doctor. So I do recommend that if you can, you try to get a vitamin D level. I noticed that a lot of my patients' levels were coming back in the normal range, and I went back and looked at what the normal range was considered where I worked before, and they moved the level down. It used to be you had to have greater than 30 nanograms per milliliter of vitamin D. That's the 25 vitamin D. And that was considered to be normal. And so I was having these vitamin D levels coming back as normal, and they were between 20 and 30. And so, of course, that's not considered a good amount of vitamin D. You really need to be greater than 30. But a lot of people get that number and think that they are okay, when really that's not enough. And then vitamin D is a fat soluble vitamin. So even though you may be taking a vitamin D supplement, if you have more fat, you're a heavier person, then that vitamin D will store itself in your fat, and it won't be in your bloodstream to where you can use it, the active form of it. So a lot of times patients who are a lot heavier, they may take the vitamin D supplements, but they need more vitamin D than just the normal level, because they won't really be able to use it because it's just going to be stored in fat. So those are just things to remember and have a conversation with your doctor about, to see, okay, should I be taking higher levels? I know in my patients who have levels that are really low, down to like 12, and I even saw 5 not too long ago.
Right.
And I give them 50,000 units to take once a week. So you can get it in higher doses, and you may need it in higher doses. But, vitamin D is also a hormone. So it plays a much more important role than I think we really realize. Right. And of course, Allah made this body so perfect to where something we thought, it's just vitamin D. No, vitamin D is very, very important when it comes to immune response, because it also has a hormonal response. So it plays a vitamin role and a hormonal role when it comes to immunity, which is really important.
So anything that's fat soluble, if you're a heavy person, or it doesn't work as good on a heavy person, maybe because it absorbs in the fat itself. Is that what you were saying, Sister Mayana?
Yeah, so you have liquid, solid, or fat soluble vitamins, and then you have the ones that's like water soluble. The fat soluble vitamins are going to be A, D, E, and K. So right now I was specifically speaking about D, but yeah, if vitamin K, vitamin D, vitamin E, those will store themselves in fat. So that means that if they're stored, because you have so much fat, they have a greater potential to be stored in the fat itself, which means that they're not going to just be available in your bloodstream. So another reason why it's important to weigh properly, because again, that's something we don't even think about. Even for men who have problems with like testosterone, or men a lot of times have more estrogen if they're heavier, just because the extra fat can cause you to produce more estrogen as well. So those are just things to kind of to know and to consider as well.
Absolutely. That's good information. Absolutely.
well, we do have a question in the gallery here that says, can you please explain the difference between vitamin D2 and vitamin D3? Is there a difference in those two vitamins?
Yes, sir. So D3, you can use D2 or D3, but D3 is going to be the more active form of the vitamin D. Vitamin D goes through, it's a pretty complex vitamin that goes through a lot of different processes in order to have an active form that we can really use. You also have a storage form that we store in the liver, to where it can be used when we need to, that it can be released when we need to use it. So I recommend the vitamin D3, again, because it's the more active form of the vitamin. But if I had the time, we could break down and go through all the different levels that vitamin D goes through. Even when it comes to testing levels, we have levels that we use to test the active vitamin, and then we have levels that we use to test the inactive vitamin. That's more so the storage form as well.
Now, a lot of COVID survivors that I've talked to, they'll say stuff like the doctor told them that their antibodies have built up within their body. They have an extra defense mechanism just because they survived COVID. Is that real, or is that just something they tell you just to give you more confidence when coming back into the world?
I think I saw a study related to that. However, it's best to be safe than sorry. As far as wearing masks is concerned, as far as being proper hygiene is concerned, as far as distance is concerned. So don't fall asleep. Don't fall asleep because it's we don't unless you're actually being tested to see whether or not your antibodies are elevated, then you really don't know. If your body reacted and stored enough antibodies to get over another pass, particularly with this Delta virus variant, I should say.
We had another question from the audience. Someone asked about body mass index. So weight and body mass is something that's a big part of when you're taking their vitals, their weight and their body mass.
Yes, sir. So the body mass index is going to be a calculation that's taking into consideration your height and your weight. And so if you are between, I'll say 20 and 25 on your BMI, that's considered to be a normal weight. Once you get to 25, well, above 25, so I'll say between 25 and 30 BMI, that's considered to be overweight. From 30 to 40, you're going to be obese. And then when you start getting up to a body mass index greater than 40, 50, you're going up into like morbidly obese. And so that's something that we take into consideration because, again, everybody has their ideal body weight. And if you are at your ideal body weight based on your height, then you should have a normal body mass index. And then typically, if that level is not, like around 25, then you're going to be overweight or obese. And we just take that into account because, there are a lot of patients who are obese, not obese, obese. And they consider themselves to be overweight. And I think that's a conversation to have. I don't feel like the BMI charts really are, how can I say it? They really aren't tailored for African Americans, so to speak, as far as like how much we weigh and our heights based on, it's more so Caucasians. But I still use it as just a gauge. I try to tell my patients at least they have a body mass index that is less than 30. When you get greater than 30, then you really are more so in that obese category. And you want to be less than that. Try to be a healthy weight.
Yes, ma'am. Okay, well, we wanted to start with the closing remarks.
So, is that for us? Okay.
Yes, sir.
That's us, sister.
He's on mute. You're on mute.
Yes.
That's Sister Quayla. Hold on. You see, I can't hear you, sis. Okay. Okay, I grab it. So we're gonna start with closing remarks. Let's start with you, brother. Son, you seem like you was ready to take off. Start out with you, brother.
So, as I mentioned earlier, that this coronavirus has proven who, at least to me, is obvious who the Honorable Minister Farrakhan is, and the efficacy of these teachings of the Most Honorable Elijah Muhammad. I think, and I'm just gonna make it simple. And I thank you for this opportunity to come on your show. I thank Dr. Miata for being here. I thank you know Allah for allowing me to serve as a nurse for Yaqub in reverse. You know,
Yes, sir.
you know, and until see, it took me a year, the second variance, to actually understand when it said that that nurses are on the front line. Because when you're in, I mean, I couldn't put words into what I was seeing. I mean, because when you're in it, when you're right there, it's hard to step back and see what's going on, you know. And I've seen quite a bit, you know. I've seen good and I've seen bad and ugly. You know, I've seen believers. I've seen many of our people. You know, and I understand the our history a little better when it comes to our 400 years in treatment and what we have gone through, and I understand now the purpose of the government cheese. I understand now the purpose of the WIC and all of that better than I did before. So I think that the teachings of Honorable Elijah Muhammad, for those who are unaware, is something to look into. I think that the minister July 4th lecture is something to revisit for all of us. Again, thank you for this opportunity. I thank Allah who came in person, Master Fard Muhammad, for my gifts.
Yes, sir.
All right, Brother Hassan.
No,
I got an extra credit. I got a question for Brother Hassan. I got an extra credit, Brother Hassan.
5
This is
points.
extra credit.
5 points. 5 points.
5 points, Brother Hassan. The uncle of Mr. W.D. Farrard lived in the wilderness of North America, and he lived other than himself. Therefore, his pulse beat 78 times per minute, and this killed him in 45 years. How many times did his pulse beat in 45 years? Are you telling me that pulse oximeter that's required in our homes now, does that give us this information that we have in the supreme wisdom?
Well, it'll give what you need to know to get to the hospital now.
Okay, yes, sir. All right, yes, sir. Yes, sir.
All right. Final words for Sister Miata.
Yes, sir.
I'm sorry,
So,
Dr. Miata.
that's fine. Yes, sir. So, we really are so truly blessed to have the Honorable Minister Louis Farrakhan in our midst, who is just teaching us and guiding us. I would have to say, look back at the criterion, read the Final Call newspaper. We were so blessed recently to just get this information and treatment options for COVID. So if you have any MDT, you want to get with your MDT, your wives, and make sure that you read through that book. The information is excellent. We were told that scholarship from hell would not defeat this virus. And so we're getting scholarship from heaven, and we're going to heaven to get the cure to this virus and to be able to protect ourselves, our families, our communities. And so I would say feed on the word of Allah, keep your spiritual up, your mental, and just keep feeding on the word. And that's going to protect us in addition to the information that we're getting directly from the Most Honorable Minister Louis Farrakhan.
Yes, ma'am.
And thank you for having this show and using your platform in this way to educate our community and our nation. Thank you so much, and to everyone here today.
Yes, ma'am.
Thank you, Dr. Matt. Thank you, Brother Hassan. Thank you. Well, I don't know what to say, but this is a wonderful night. We're gonna let this close out. We're gonna close it out with
No, we need
comments.
final words from you.
Oh, I thought I was gonna get closing comments from the JAKQ brothers. But
Right.
is it my turn?
No, you handling this, sister. He just in your way. Let's move Brother Kyle out your way. Yeah, go handle your business, sister.
Oh, yes, sir. Yes,
Yes,
sir.
ma'am.
Brother, hey, closing comments, sir.
I mean, basically, you said Ahmed.
I believe that is the A in JAKQ Brothers, Brother Ahmed.
No, I believe that you know, our guest pretty much summed it up. I just wanted to say that we all deserve good health and longevity and a good quality of life, and we really have to take it serious. A brother asked me the other day, what are we learning from this COVID? It's something that we discussed on the show, is that we really need to take our health seriously. We really need to focus on our eating, our exercise, and we really need to really buckle down and get our immune system in order to live not only today, but this virus is going to be around forever. It's like the flu now, so it's going to come in waves. So we have to now prepare our bodies to fight this if we want to be around for our families and our children.
Yes, sir. Thank you. Allahu Akbar. Wonderful. Brother Jackie, Ahmed, any closing comments, sir?
Yes, ma'am. I want to thank everybody for coming on. Thank you all for sharing your information that you have. Me and Brother Ahmed was talking. I don't know if that was earlier today or yesterday. But any brothers that are out there listening who has not been to the doctor,
Right? Come on, man.
we like Brother Hassan said, we wait to the last minute, but we are supposed to go annually, yearly, and we got to stop putting it off. I can't imagine that I haven't come in contact with the COVID. I think a lot of He has allowed me to, continue to function in health wise, but I can't imagine that I have not come in contact with it. So even if you come in contact, your body fighting it, doesn't that put wear and tear on your immune? So even it could affect something else that's going on with my body. So I cannot no longer take it for granted. So brothers, let's go get checked. Let's go get checked. If you don't have health insurance, let's find a free clinic, but let's go get checked.
That's right.
No excuses. And because we have had a wake-up call here in the Brotherhood, with COVID-19, and it was a wake-up call for me in particular because my brother was healthy to me. So we definitely need to go get ourselves checked to make sure we don't have any underlying conditions and taking the little pain that we feeling in our toes for all these years for granted. So thank you all, brothers and sisters, for sharing with us today. That's all I got.
Thank you, Brother Jackie. Thank you so much. Yes, sir. Brother Kawi, any closing remarks, sir?
Yes. First, I'd like to thank the guests for coming on today and blessing us with Allah's permission with your information. I never knew that Dr. Mayada could multitask as well as she do.
Right.
I mean, she can handle a baby and keep her thoughts while giving her answers. That right there, we need to shout how all day. Good job, sis.
That's right.
And Brother Hassan, man, I really appreciate you and being able to tackle the questions the way that you did in such a way that you did. I mean, like Brother Jackie said, man, we just got to get checked. All the brothers out there. I mean, I'm one of the ones that caught COVID and overcame it by the grace of Allah. I was in bad shape. I mean, real bad shape, and those vitamins that the believers came over with vitamins B, C, and D, and K, and I just like took those vitamins 2 and 3 times a day, and now I'm over here talking to you. So I don't know if
did you get some of that? Did you get some of that vitamin H?
What is that?
I'm sorry.
Come on, bro. Bruh. Bruh.
No, sir. But no, I think a lot of people, you know, I've been getting a lot of text messages, a lot of about this show, and about some of the things you've been saying. I think you really cracked some atoms tonight, and I appreciate you coming to the show and sharing your information with us. Thank you.
Thank you, Brother Kawi. And I'd like to thank again Dr. Mayada and Brother Hassan. Your information that you shared, it's wonderful. And sharing information is how we all get across, not just one of us, all of us. And if we don't share that information with one another, all of us lose, not just because we impact each other's lives in memories and friendship and how we move together as a unit of one. And so we must make sure we all get across, all of us, and not leave one behind. So once again, I want to thank you all for coming on the show. Yes, Brother Kawi.
Oh, we forgot one person. I'd like to thank you for coming on the show, sis.
Right, good job.
And gracing us and blessing us with your eloquence, your class, your etiquette.
Peanut butter.
Yes. Thank you, brother.
Thank you, sis. You was a magnificent moderator. Yes, ma'am.
Excellent job, Sister Akilah.
Thank you,
Excellent
Brother
job.
Thank you, Dr. Mayada.
Can I add one last little thing real quick? I guess
Yes,
I could say this. So I know that we're forming a task force here for COVID in the southern region. So if if anybody is affected by COVID and you're having some symptoms and you're really concerned, then you should first reach out, to your captain, your student captain, and they will escalate that information up to the to task force to try to get someone in contact with you who can assist you. It's only for if you think you have COVID, so not everything we're going to be managing or helping to assist with, but we know a lot of the believers don't have health insurance and don't have a primary care doctor that they can go to. So myself, I know Dr. Darnita, and some other doctors within the nation, we are trying to make ourselves available, and they already have made themselves available to quite a few believers here in the southern region and even around the nation. So just make sure that you're in contact with your captains if you do have some symptoms and you're really concerned, so that we can get in communication with you and assist you. Okay.
Thank you. Thank you. All right. Yes, we'll have a good night.
Thank you. What exciting.